Warm welcome to you from Geneva, Switzerland. This is Reda Sadki of the Geneva Learning Foundation, and we're about to kick off the Second Impact Accelerator for Immunization Agenda 2030. What is this Impact Accelerator? What are more than 8,000 members of this movement being called to do in the coming 4 weeks? That is what you'll find out in 1 minute, 25 seconds. We have a packed agenda for today's session. 3 good reasons to actually join this assembly are the following. First of all, you're going to hear from Charlotte Mbu, who just spoke today on behalf of the Movement for Immunization Agenda 2030 at a side event of the 75th World Health Assembly dedicated to Immunization Agenda 2030, really speaking the voice of the movement. Find out, second good reason you don't want to miss today's assemblies. You'll find out the 2 simple steps you need to take to succeed in the IA2030 Impact Accelerator. One thing happens, one step is on Monday, the second step is on Friday. And then also we'll tell you how to get help in the Impact Accelerator. And then third, after the assembly, you'll be able to, for the first time, join fellow members from your country to meet in an audio call. And we have some more exciting opportunities that I'm going to save for the assembly itself. Keep watching if you're watching the recording or listening to the podcast. A warm welcome to you if you're new to the movement. A warm welcome to you as well. Whatever the case may be, we want to make sure that you are feeling good and that you gain from joining this movement. Here we go. Warm welcome to you from Geneva, Switzerland. I'm Reda Sadki, and we're kicking off what we call the Impact Accelerator. And for the very first time at the end of this assembly of the Movement for Immunization Agenda 2030, we'll be convening members of country teams. So whatever country you are from, you will be invited to meet with fellow members of the movement from your country using the application Telegram. You can see some instructions here for those of you who are with us in the studio. I'm also going to share, to paste in the links. There is another option which I'll come back to in a minute or so. So I'm going to paste both options for what happens at the end of this assembly. So here we go. Let me just make sure that this is, yes, here we go. So now the big news is, in fact, that this morning something quite exceptional happened for the very first time in the Movement for Immunization Agenda 2030, and this has to do with the 75th World Health Assembly. There was a side event dedicated to Immunization Agenda 2030, enhancing the essential immunization program at the heart of pandemic preparedness and response. With us is Charlotte Mbu, of course, of the Geneva Learning Foundation, but also the voice, a voice for the Movement for Immunization Agenda 2030. Charlotte is going to tell us why this morning she headed for the Canadian diplomatic mission. And then we have some pictures of her from this morning that show her in action. You can see right there next to the ministers is Charlotte Mbu, who was invited to speak, to explain to the assembled dignitaries and other officials attending the World Health Assembly what is this Movement for Immunization Agenda 2030. So we're here with Charlotte. We share the news via the Telegram channels. We didn't share anything earlier because these things are always decided at the kind of at the last minute. Charlotte, how are you doing? First of all.
Hi, Reda. Hi, everyone. I'm doing great. Thanks.
All right. And so tell us, what did you say on behalf of the Movement for Immunization Agenda 2030 this morning? What were your key messages to this assembly of very high-level dignitaries, ministers, and others who are participating in the World Health Assembly? And what did they respond?
Thank you so much, Reda. First of all, it was an honor for me to be the voice of the movement, to showcase all of the great work that you have been doing together. And I had the opportunity to share the panel with the Minister of Health from Colombia, and the Director of Health Services from Bangladesh, as well as the Minister of Health from Ghana. And we were there to look at, first and foremost, on the impact of COVID-19 on immunization, and how lessons learned from that as far as routine immunization is concerned, but also most especially the IA2030 movement and the contributions of frontline health workers to the success of that movement. So what I was there to do was really to showcase the wonderful work that members of the movement have been doing through this digital human network, through the experience sharing, what we have been learning, how the ideas engine has contributed to help in the improvement of immunization performance, how experience sharing is helping people to transform their immunization services. And I cited a few stories, but those were just a couple of stories that represent the thousands and thousands of stories, the difference that you're making on a daily basis. And I really just wanted to say that vaccines, investment in vaccines, investment in technology, investment in infrastructure in order to prepare for pandemics or to respond to a future pandemic is important. But what is more important is investing in people, in a people platform, and that is what we represent. The Movement for Immunization Agenda 2030 represent a people platform that cuts across system level, cuts across countries, cuts across organizations, cuts across gender, and just embraces everyone that has a heart for vaccinating children, for vaccinating our target population. And it was a call for all those stakeholders to be able to support or to join us to flame this fire that since we responded to the call of the Director General of WHO, Dr. Tedros, that they should join us as we, set the world ablaze with the work that we are doing with our movement, because the real difference is the people on the front line who are actually administering the vaccines to those who need it most. Sorry for taking a little bit too long, but I think there's so much I have to say.
There's a lot to unpack. Let's take it one step at a time. I can sense the excitement in your voice. This is a unique opportunity, but there is, first of all, one thing that I'd like to ask the members of the movement to do right now. And I'm pasting 3 links. One is Twitter, the other is LinkedIn, the third one is Facebook, whichever. If you're on any of these social media platforms, you can just go to these links, and I'd like to ask you to do it right now. You don't need to wait. Why do it? This will help amplify the movement that you are a part of. Charlotte was not speaking in her own name or her own name only. She was speaking as a member of the Movement for Immunization Agenda 2030. And Charlotte, I can tell you the reactions on social media. So we have, all right, so Yomi Newton is just saying, joining us from Lagos, Nigeria. Dr. Karar Shah Syed from Pakistan. Anuo Luwapo is watching from Nigeria. Shona from India says good afternoon. Kimisha Shaw Kelly from Jamaica. And Mercio New Peter says, great work, Charlotte. Dr. Bala Ganesa Kumar from India is here. Now, Charlotte, you only told us the first half, what you said, but what we want to know, what matters even more, is what this group of ministers and other senior global health figures said in response to the idea that thousands of health professionals have come together, more than 8,000 actually, 6,000 is the old number, in order to make a difference, to progress towards the goals of Immunization Agenda 2030. So what was the response?
I'm actually smiling because we got positive responses from the stakeholders present. Studies from WHO, there was UNICEF, but also the Minister of Health for Canada, who closed the event, was like saying that our message is a message of hope, to see that we are able to cross boundaries, to cross borders, and be able to learn from the experiences of one another and use those experiences to bring about change as far as immunization is concerned. They find that is great, and we really do hope that from that will come up, like I said earlier, positive result in terms of tangible support to carry forward really the work that members of the movement are doing. And just sharing like a couple of stories about vaccination angels, that those are community women that are taking the message of vaccination in a country, in one country, and how that could impact other countries. To see that there is this network that exists, it's incredible. And probably we do hope, since it was a message of that is what he saw in our message, that we do hope that they'll be able to build on that to help us move forward with the movement. Thank you, Reda.
Thank you, Charlotte. So it's great to hear so much of what you experienced this morning. Now, the purpose of this assembly is to hear from other members of the movement. So I've put the question on the screen. What does it mean to you that the movement actually spoke this morning in the context of the 75th World Health Assembly? This was the side event dedicated to Immunization Agenda. So if you'd like to respond, and if I see Evans Amoasi has a hands raised, so that may be a leftover hand, I don't know, but Evans, I'm asking you to unmute. And Charlotte, I'd like to ask you to take it from here. You are the voice, one of the voices of the movement. You are also the facilitator of the movement. So please tell us, who shall we hear from in this session in order to hear more voices about what it means to members that the movement spoke this morning at the 75th World Health Assembly?
Okay, Reda, thank you very much. So I'm inviting Aliu Usman. I don't know if you're able to unmute yourself. Your hand was raised, and please go ahead, over to you, and do remind us who you are and where you're joining from.
Good evening, everybody. Hello.
Yes, we can hear you loud and clear.
Yes, good evening, everybody. I'm Dr. Aliu Usman Muhammad from Yobe State, Nigeria. Actually, this is my second time of joining this movement with regard to the immunization. And then it is highly encouraging. And then I find it is worthy to share with everybody. Actually, there is a lot of knowledge and ideas actually that someone will learn from this movement. And then I think if the world will move with this kind of innovative approach to the vaccine or immunization, we'll have a zero tolerance to vaccine. And then we have a full coverage for the vaccine actually in every situation. Like for instance, here in Yobe State, where we have a lot of insurgency, people, they migrate, they are being displaced from their various places. So it's very difficult to track them when they have started taking immunization so that to complete the routine immunization. So this is some of the challenges because they keep on migrating from one place to another. So in this platform, someone will learn a lot of experience in which, if applicable to the different region or different location in everywhere in the world, it will help actually. Like for now, I learn a lot of things every day that I attending this kind of the program. And then for my own plan, I am planning for vaccine information management system, in which I am trying to see how I can optimize it in the hard-to-reach areas, and then for specifically for internally displaced person. Thank you so much.
Thank you so much, Aliu Usman. We are going to go directly towards Eda Kanini. Okay, over to you, Eda, and great to have you with us today. Please remind us who you are, where you're joining from.
Thank you, Charlotte, and really I'm happy to see you today. My name is Eda Kanini. I'm joining in from Kenya. I would say seeing the representation at the 75th Assembly has really made me happy and encouraged. It's a voice for all of us. Maybe we could not all be there, but what was said there, really, we feel our voice was presented there. It's such a motivation to know that the whole world has, the ideas that we've been sharing has been shared with the whole world. We've learned a lot from each other. I know not everybody from the world has been able to join us, but the voice that really represented us there has been able to, to give the message to the people. So I look forward to continuing with this community, and I'm so happy. I think it's a motivation. Thank you, Charlotte.
Thank you so much, Eda. I think we're going to move forward.
Thank you very much indeed. What is the future of immunization? That is the question we asked now over a year ago when we tested the waters to find out if Immunization Agenda 2030 could in fact be a rallying cry for immunization and other primary healthcare professionals from all over the world. I believe we've now answered that question. I'd like to offer a round of applause to every member of the movement who, where they work, with their colleagues, with their boss, with their friends, with their families, have spoken about the incredible way in which people all over the world, you'll see the numbers, the updated numbers this week, have joined. And most of all, today, our very own Charlotte Mbou was the voice of the movement at the World Health Assembly. So we are talking about 44,885 immunization professionals that this platform is reaching today. As we say every week, we repeat this, think about it, consider this. This is not only about the connections that we make with you, it is about the connections you make with each other. And in fact, you can see the barometer from week to week, which we ask you every Friday, how are you doing? We ask you to tell us that you're still active in the movement. And the numbers keep going up. The numbers keep increasing in terms of the effects that you're feeling, the way in which the movement is changing you. So this is the second set of questions. What has your participation in the movement changed for you? What do you expect from the next phase of the full learning cycle, which we call the Impact Accelerator? If you don't know, you don't fully understand what you're going to have to do, we're going to tell you. But what are your expectations? I'm going to turn to Charlotte to tell us who we will hear from now. And I'll share one message. There are many messages across social media. So Dayo Adeoye, who says, afternoon all, sorry for coming late. This is no laughing matter. I just left hospital bed now since last week, Wednesday. Mr. Dayo Adeoye from Nigeria, Ogun State, thank you. I'm glad that you are better and impressed that you thought of the movement, that the movement was in your thoughts and that you're back with us. I hope you'll be able to fully participate. Charlotte, over to you.
Okay, Reda, I'm inviting Hassan. Okay, Hassan, your mic is already unmuted. Over to you, please. Hassan Benya, I see your mic is unmuted, but we are not able to hear you. I hope your connectivity is on your side. And please do raise your hand if you want to answer the questions on the screen. And I really encourage you, if you have never spoken before, please do raise your hand, especially if you are the only representative for your country. And also, I really want to listen to women who deliver vaccines who have never spoken before. I'm going to try Jamilu. I'm inviting you to unmute, and I hope we'll be able to get back to Hassan Benya later on when the sound is better. Hi, Jamilu Bashir.
Are you hearing me?
Yes, we can hear you now a little bit.
I'm taking question from Nigeria. And I'm sorry, I didn't get the question clearly.
The question is, what has your participation in the movement changed for you? And what do you expect from the Impact Accelerator? Yes, unfortunately, there's a lot of background noise. We are not able to hear you well. Let's try again, please.
Yes, Charlotte, I suggest we go to Gentil Faraja because I see many hands raised, including all right, Umar Garba, who seems to be having a different conversation. That's okay. This is so let's try with Gentil Faraja. Are you there? Are you able to speak to us, please?
Hello, can I make sure you just hear me, please?
Yes, loud and clear. Let's start with your introduction and tell us when you joined the movement.
Yes, thank you for having me. I'm Gentil Faraja from the Democratic Republic of Congo. I'm located in Goma, eastern part of the country, North Kivu. So I joined the movement for the first time once it was launched, but since then I was embedded in huge issues, so I didn't have much time to reconnect again. But just completed my action plan for the immunization movement 2030. I completed, I think, it today, and ready now to tackle all the remaining issues. So I'm representing the Center for the Promotion of Vaccination. That is a center of one non-profit organization known as African Initiatives for Natural Resources Development. Um, and so we have realized the first activity in Goma, and this activity is the survey that we have carried out across all the city of Goma. And the survey is about the perception of the population of Goma towards vaccination in general, and especially COVID-19 vaccine perception. And we have produced the report that is now being shared to all the stakeholders, and to even the governor of the province also is going to receive the copy of the reports. Now we have launched the activities across all the townships and universities, because the results that we have got through this survey is that 44% of people in Goma are vaccine hesitant. And so we have to work hard, because 31% are anti-vaccinationists, and only 25% of people are vaccine uptakers. So we have to make sure we improve confidence and trust in vaccines, and this is the job now we are working. So I think I submitted other parts of the project on which we are working right now. But at present, we are making sensitizations across townships, universities, and working with local leaders across the town, so we can make sure these people are influencing people towards vaccines updates. So in short, this is what I can say, and I'm very happy to be part of this international movement, and I'm hopeful, the feedback we are getting, the trainings we are getting will help us improve our job on the ground. So that's the short I should just tell right now.
Thank you very much, Gentil. Your participation in the movement.
Reda, before we move forward, there's a comment from Diana Avino that I would like to read for the sake of those who are following us on social media. Here in the chat, in the Zoom studio, she says, as an ordinary Ugandan woman who could not even come to dream of Harvard, but the movement has brought Harvard to me. This morning, I got an invitation from Professor Viz Warnard, Harvard School of Public Health, to get exclusive access to the Curve module and mentorship. I am so excited.
Thanks, Charlotte. We'll explain, because not everyone received the invitation, but I'm glad, Diana, that you did. We'll explain what that is about and what that has to do. That is very much something that has everything to do with the movement and the full learning cycle. So this is a series of activities. Some of you have been here since March the 7th. Some of you have just arrived. Whatever the case may be, when you add up all of the individuals, all of the health professionals who have said, I am joining this movement, I am making a pledge to achieve impact, it totals up to 8,254 health professionals that are in the movement, that have pledged to achieve impact. We will see how many make it to the finish line, and from the 9th to the 20th of May, members of the movement began to develop action plans. And by the 20th of May, 820 of you had already done so. What we're going to do before we introduce and launch the Impact Accelerator, the next stage, to say one very important thing. And I say this, if you have not yet developed your action plan, you have not missed the deadline. You can still join the movement and join the Impact Accelerator. In fact, the only condition is that you submit your action plan. That is all you need to do in order to make it into the Impact Accelerator. I'll be explaining in a few minutes exactly what that means and what difference that can make for you. So now, 820, and you know how we do this. For those of you who have done this before, if you're new, we recognize, honor the countries and the individuals within those countries who make it through each of the successive stages of the full learning cycle. So here we go. First, go in alphabetical order from A to Z this time. And first up is Afghanistan, with 3 members of the movement who were successful in developing their action plan by the 20th of May. Now, if you are from Afghanistan and you did not yet develop your action plan, but you want to join the accelerator, I want to emphasize that you can still do so and are very much encouraged to do so as well. But we want to acknowledge those who did it within this timeline. From Angola, we have 1 member of the movement. Argentina, 1 member. From Bangladesh, Dr. Hadija Ahmed. From Botswana, 3 members of the movement. 2 from Burkina Faso, many more on the Francophone side. 1 from Cambodia. 9 from Cameroon, 9 Anglophones from Cameroon, 1 from Chad, 4 Anglophones from the Democratic Republic of the Congo, 14 from Ethiopia, 2 from the Gambia, 2 from Georgia, 67 from Ghana, that's 1 from Guinea, 1 from Guyana, and if you are the only member of the movement from your country who completed the action plan, it is not too late, and I would like to challenge you, Annika Scott, to show us that there are other people, other health professionals that you work with in Guyana who are ready to take up the challenge of the movement, to contribute to the movement for Immunization Agenda 2030. Next is India, with 22 members of the movement who successfully completed their IA2030 action plan. Again, there's the opportunity to multiply the number of people from India, from every country, who are participating. Beyond joining, we know there are thousands who joined. We'd like to, dear Ahmed Mohammed Niyama Abu Raghib from Iraq, we'd like to see fellow Iraqi health professionals join this movement, and we call on you. You did your action plan, you're in the accelerator. Your colleagues can still join, can still contribute. 1 from Jamaica, 19 from Kenya, 5 from Liberia, and 5 from Myanmar, 1 from Nepal, 1 from New Zealand, and now, please, a round of applause, even if you're alone in front of your computer screen, for the largest team in the movement for Immunization Agenda 2030, with 172 members of the Nigeria team who successfully completed their IA2030 action plan and who are now in the Impact Accelerator. Will tell you exactly what that means, how it works. Pakistan, 26. Paraguay, 1. Rwanda. Saudi Arabia. Sierra Leone. Slovenia. Somalia. South Africa. South Sudan. Sudan with 5 members, the Republic of Tanzania with 4, and 3 from Timor-Leste, 1 from Togo, 16 from Uganda, 2 from Zambia, 1 from Zimbabwe, and then a number of members of the movement who work in an international context. To give you a better sense of what the challenges are, almost half of you, 47.4%, says your main challenge that you're focusing on in the action plan is reaching zero-dose children and missed communities. The split, more of you in the Anglophone side are work in rural contexts, and the challenges you face, your action plan is focused on the rural context, but almost 40% on the urban side. Most of you estimate 7 to 12 months as the time you need to achieve the goal of your action plan, and almost 4 in 5 have already started to take action toward the goal that you have. Most of you, unfortunately, need additional funding to achieve your goal? I say unfortunately, because an action plan that requires additional resources, that is not built based on the existing capacities, is going to run into this first barrier of having to secure that additional funding in order to move forward. So before we move any further, I'd like to turn now to François Gass, who's been our guide on the side, working with Charlotte and Boo in the experience sharing sessions and many other contexts, engaging with you, challenging you to think, to ask questions, to look for the root cause, to question what you think is the root cause, and to go further in order to prepare for implementing an action plan that is well thought out. François, I'm going to ask you to unmute. There does seem to be a Zoom bug with unmuting right now. How are you doing? And what are your thoughts as you see an impressive number, over 800 people who already have their action plans, and more are still coming in every day? What are your thoughts? What makes the difference between a plan and execution, actually implementing the plan?
Thank you, Reda. Good afternoon, and hello to everyone, to all those who have decided to write an impact accelerator. And I think it's incredible, because you've done a situation analysis, you have identified a challenge, you have identified actions to implement. I say those actions that you put on paper are only worse if you implement them and you get a success out of them, reaching an objective you will set. So, as I'm sure you know, it's easier to get an idea than to implement ideas, because you will face your local challenge, local environment, local difficulties. But I think what's important is that if you have decided and you have set an objective, you have found justification for that objective, you have found the root cause, you have defined action, you already enter in the road to get an impact of your ideas. Now you will have to, of course, choose the action step that will need to implement your ideas. As you know, you may have an idea, but you will know to decide the few actions that are required to get your action implemented and hopefully achieve the results, the objectives you have determined. And this is extremely important. And I think you're in charge, you know your environment, you can decide, you have assessed what you should do, and now you are going to follow up the implementation, hoping to achieve results using this community who are all having some extra impact accelerator and will share their experience and may help you to do better, to do harder. If it's already an action you're getting already ongoing, they will help you to work harder and to achieve more than you would have done alone, because together you do much more than alone. So we will be there, Reda, Charlotte, myself, to accompany you during this effort to Impact Accelerator, which objective is by the 17th of June. You should have able to implement at least one corrective actions to go towards addressing your challenge. So thank you for all being there, all motivated, part of the movement, and moving forward, and looking forward to that travel, that journey with you. Thank you, over to you.
Thank you very much indeed. Dr. François Gass, our guide, has on the side since the 7th of March. And the number of immunization professionals who've confirmed participation for the Impact Accelerator is impressive. More than 4,129. But I'd like to challenge you, if you have not yet submitted your action plan, I'm going to ask Charlotte to share the link so that you can go and do that right now. You don't have to wait. You can do it during the assembly. As you're listening, you can go and set define your challenge, define your goal, share your corrective actions. If Charlotte will share it in the chat as we move forward, because we ask you a simple question. And if you do not want to be left behind, you need that action plan. It is a questionnaire. You fill it out. You do it for you, for your own needs, because the action plan is going to be focused on implementing in your local context. And it is really a simple question you need to respond to. Are you ready to take action? It's not about any one platform or network. It really is about you. It is about your leadership, your capabilities, your potential, and your commitment. And the evidence for this in the movement has been obvious. It is your efforts and persistence, your willingness to help others, and your allegiance to helping each other. This is all driven by your commitment to impact, your organization's and country's commitment to the same. That is what the accelerator is about, and I'm going to tell you the incredibly simple way in which it works. Monday, you do one thing. Friday, you do one thing. That is all you need to do. There are 4 pillars, and it started with a pledge. At the end of this assembly, I'll ask Charlotte if we have time to read the Scholar Pledge to actually achieve impact, but it is also about measuring, sharing, and mobilizing. Now, I want to turn back to Charlotte to ask her, who shall we hear from for this next sequence, which is about why you want to join the accelerator and about how you think it is going to help you implement your action plan. I'm going to tell you the 2 specific things you'll need to do each week for the next 4 weeks. 2 simple, specific things. But first, we want to hear about your expectations. Charlotte?
Okay, Reda, and I'm encouraging you to raise your hand, especially if you have never spoken in any of our sessions before. But I'm inviting Kasim Ibrahim. Your hand is raised. Please go ahead and unmute yourself. We also have Dr. Kazi. So are you able to unmute? Kasim, please go ahead and unmute yourself. And we may also try again Hassan Benya.
Hello, good evening.
Good evening, and please do start by reminding us who you are and where you're joining from.
Hello everyone.
Yes, hello to you. We can hear you.
Yeah, please, I wanted to add about what you are saying about this immunization. I'm Kasim Ibrahim Kuli from Nigeria. From the Bigawa State.
Yes,
Yeah,
Kasim from Nigeria. Yes, tell us why you want to join the Impact Accelerator. We hear you loud and clear, but we want to know, why are you here today and why do you want to join the Impact Accelerator?
Yeah, number one, why I'm here, I want to just hear, I want to hear and I want to be all to hear the experience where we are talking about. And I want to share my experience here from our country.
And Kasim, can you tell us, when did you join the movement for Immunization Agenda 2030?
Yeah, I have been joined since the beginning of this program, but because of some issues, I couldn't be able to join the meeting every week.
Well, we are glad you remain a member of the movement, even if and when you are unable to attend. This is very important, as long as you stay committed to achieving the goals of Immunization Agenda 2030. Is that the case for you?
Yes, sir.
Are you still willing and interested in contributing to achieving the goals of Immunization Agenda 2030? Yes or no?
Yes, sir.
All right, back to you, Charlotte.
Yeah.
Okay, thank you, Kasim, and thank you, Reda. So the next person we are going to be turning to is Jamilu. Are you able to unmute? Oh, we have a number of days. Okay, Jamilu, over to you, and please do start by reminding us who you are and where you're joining from.
Hello, everyone. I'm Jamil Bashir Fogo from Nigeria. Are you with me?
Yes, we can hear you loud and clear. Why do you want to join the Impact Accelerator, and how will it help you to implement your action plan?
Thank you, Charlotte. Actually, I have come so far, and I want to see how it's going to be end. And I want to make sure that I have got exactly what that I supposed to have to help me enhance my activities of immunization and to share my experience in terms of immunization here from Nigeria to our states.
Jamilu, we are not able to hear you again. Okay, maybe Jamilu is having technical issues, so I'm going to turn towards Syed. Syed Miraban Shah.
Hello, Charlotte.
Hello.
I'm audible?
Yes, you're loud and clear.
Okay, thank you. This is Dr. Miraban Shah from Afghanistan, the WHO working with the country office. Why I do want to join the Impact Accelerator? Actually, I want to join the Impact Accelerator for that reason that the problem in the issues, particularly regarding the immunization in Afghanistan, and I want to learn from the colleagues in all over the world about the what are they doing for the immunization and how they are achieving their targets and how they are reaching their children, particularly zero-dose children or those marginalized or underserved communities. So it will help me to work in my country and to reach those areas where we are facing problems and the vaccine preventable diseases are spread over there, and the outbreaks and sporadic cases are reported all over the country. So it will help me to reach and plan accordingly and identify a challenge, even though there are many challenges regarding immunization services, but my challenge was regarding the frequent measles outbreaks in the country, and for that I prepare an action plan, and the goal was to reduce morbidity and mortality attributed to measles in the country. The action plan which I prepared, but unfortunately at the last stage, even though I have submitted my action plan and I did my action plan at the moment, I 2030, but at the last time I hear that we are facing shortage of stock out of reconstitution syringes in Afghanistan, and it is even not sufficient for the routine immunization. So how I will be able to implement the plan activity which I did for the measles outbreak response for 111 districts more in Afghanistan, even though I have already implemented first round of measles outbreak response in 49 districts in the country, but we had planned to implement measles outbreak response in 111 districts in May, and we have the WHO had enough budget for that one, but unfortunately we couldn't get the reconstitution syringes and the vaccines, MCV vaccine on time. But now they are saying that the vaccine in other non-vaccine supplies will reach to Afghanistan within 1.5 months. So we have to wait for that. So we are not sitting, but we recently today we had started the national immunization days for polio campaign all over the country, and it will continue for 4 days. And in this from the 1st June, we have a plan for COVID-19 vaccination to be implemented in the country through the fixed sites and also through the mobile teams, and they will go to site and vaccinate eligible or target population in the country. So this action plan really helped me, and I have think out of box, because for the routine immunization and it is not working. So we have to think out of box to reach and vaccinate those marginalized or underserved communities or children living in urban slums and the rural settings. And particularly the education level is not, literacy level is very poor in the rural setting, and people are not, don't have concern about vaccination, and their demand is very low in the country, and they are not vaccinating children. Based on the surveys conducted in the countries, and it is showing that upper quintile are more vaccinating their children and women in comparison to those with low literacy level in the rural settings. So these are the things, but now I'm very worried about that I couldn't implement my action plan based on the timeline or deadline which I set for it. And we was in consensus with the national EPI. They were also agreed to implement the campaign, but due to our UNICEF colleagues, they couldn't supply in due time the reconstitution syringes and vaccines to Afghanistan to start my activity. However, from my side, thank you.
Thank you, Saeed.
Yep. So I've been sharing. So Syed, we'll come back to you because I think lesson one of action planning is that you need to be ready to adapt and change your plan when the environment around you changes. And here you can see the 5 most valuable aspects of the accelerator. I hope you'll join us in experience sharing to hear what other colleagues have done when faced with similar changes in the external environment. The key of the accelerator is not the rigidity of your plan. It is about really building momentum. And we will be reporting by country how each members of a movement from each country are doing, hopefully fostering a healthy competition. It is about networking, helping each other overcome difficulties and leverage resources. Now, Syed, I think you are not alone in having this particular problem where your plan, you developed a plan, but your situation has changed. But for those of you who have not yet done so, or those of you who need to sort of revise your plan, the simplest way to do it is simply just to go to this link and follow the steps. Really just answer the questions. And I'd like to ask those of you who have not yet submitted your action plan, if you're here in the room, this shows commitment, this shows dedication. I'd like to ask you to follow the link I have put in the chat and report back yes or submitted, as I'm going to do here, once you have actually submitted your plan. So don't do it if you've already done it, but if you have used the link, if you don't have your action plan yet, you can do it right now as you keep listening to the Impact Accelerator presentation, because I'm now going to tell you how to actually participate in the accelerator. And unlike some of the other activities, such as a situation analysis that had many steps over 4 weeks, or even the action plan development that had many questions, I'm pleased to say that there are 2 actions and 2 questions that you will have to answer each week in order to succeed in the accelerator. So the first one is on Monday. You decide what action are you going to complete by Friday. Now remember, we asked you what will you do within the first month of your implementation. And when you go to the form, I'm actually going to show you what it looks like. I just need a bit of time to set up here. I'm actually going to show you what you'll be doing each week, and that is each Monday, this is what we will ask you to do. So you'll do exactly as I'm doing now. And here you have question 1. What is the specific goal you will achieve by June 17th? That is the end of the first 4 weeks of the Impact Accelerator, what we call the launch pad. Be careful, there's a 60-character limit. So you can go here and type what is a specific goal you want to achieve. I'm not going to type an example goal, but you'll have to figure out your own. You can, of course, refer back to your action plan. But Syed, speaking to your point, if the situation has changed, you can redefine your specific goal, what you want to do at least in the first month. But then there's an even shorter term goal that we'd like you to share. And this is, when you say this is the action I will take this week, that means that you'll have it done by Friday. So it can absolutely be a very modest, a very small goal, but something that you can actually say on Friday, I have done this, all right? Or if you haven't, you can reflect on what were the challenges, what were the lessons learned, and how to adjust your goal for the next week. So that is on Monday. And now on Friday, well, we will ask you to tell us how your week went. And you'll be using the same form, the same questionnaire, how are you doing in the movement, that you can see here. I'm also going to show you that one. And again, If you don't have anything to share, you can just say, I'm doing fine. If you have a problem, you can choose that. But the one we're most interested in is for you to share your experience. And this is not your experience in general. It is your experience about what went on that week and the progress you were able to make or not in the Impact Accelerator. So I'd like to challenge you again. There's so many members of the movement in the room right now. I'd like to ask you, because today is Monday, to actually, while you continue to listen to this presentation, to click on the link and set your action to complete by Friday. And once you are done, once you have set the action that you're going to complete by Friday, remember your goal. You already defined the goal 4 weeks out in your action plan, so you can refer to that. When you've actually done it, type done, and we will see the responses coming in. And so what this commits you to, you set your own goal and action for the week. But on Friday, we'll be asking you, and your colleagues in the movement will be asking you, did you do it? And this is not to accuse you or to fail you if you haven't been able to do it. It is to say, if you have done it, congratulations, keep moving forward. If you haven't, reflect on why this action didn't work out, and tell us, and use that reflection, use those lessons learned in order to set the goal for the coming week. So I'd like to ask those of you who are on it, let me just paste that link again. So again, use the link, follow it, and there are just 2 questions. I'd like to ask you to answer them right now. So that's Monday and then Friday. And that's it. That is what you do in the accelerator. We've shown in the past, we've taken 2 groups. One of them went through this weekly goal setting process and the other did not. By the end of the weeks, the first group, the group that did the accelerator, had made 8 times more progress, was 8 times more likely to have made progress with implementation of their action plan. And in between, if you need help, if you have questions, if you'd like to share your experience, we highly recommend, of course, the experience sharing sessions. Charlotte is going to share the link with the group in the chat so that I can keep moving, because we are running out of time. And I want to ask you, as you think about this, what is a specific goal that you're going to achieve within the next month? So I'm going to lower all the hands. It'll take a bit longer for hands to come back up, but I want to make sure we hear people who are thinking about these questions. What is one action you would like to complete this week? So that's by Friday. So it needs to be a small action. Be realistic about what you can do. Who would like to be the first to set their specific goal? Share it with our community, and of course, we will be accountable to each other in terms of the progress we have made and reflecting on that progress. So I see one that is Ahmed Niyama. Let me go to Ahmed Niyama. I hope that you will be able to. Yes, Ahmed Niyama, remind us in one sentence your challenge, the goal of your action plan, and then what are you going to do in the next 4 weeks? And what is the one action that you commit to finishing by Friday?
Hello, Rida. I am Ahmed Nama from Iraq. I'm the only participant from Iraq. I am working with the International Committee of the Red Cross as a health field officer, and I'm taking charge of the program of supporting national immunization program in Iraq. My challenge was the reduced coverage rate in the national immunization due to many factors, as the COVID pandemic and the security situation in Iraq, and also vaccine hesitancy, fear of visiting the primary healthcare centers. So in this 4 weeks, it's the beginning of our support program, which is calling the defaulters of the vaccination. It's not the children with 0 dose, but the defaulters from the immunization program. We started by providing donation, mobile phone, and credit cards to call the families to bring the children back to the healthcare centers. So at the beginning of this month, we provide the donation. And for this week, I'm planning to have monitoring visits to all the healthcare centers to see how it's going. Because we already provide the donation, we provide the training of active communication to the health staff. And so I'm going on field trip visits for monitoring and see how what the help we can also provide.
Thank you, Ahmed
Thank you,
Niyama. So
Rida.
we'll look forward to seeing your report on Friday come in. Tell us what you learned from these visits. And on Monday, maybe perhaps you will be amongst those who will share the progress you've made, your successes, your challenges, your lessons learned. And that we will be doing each Monday in the next 4 weeks. So again, to recap, today, I'm asking you to set your action. What will you do by Friday? And then recall the goal you'll achieve in the next 4 weeks. That is also an opportunity to revise and improve or change it. And then on Friday, we'll ask you to tell us how your week went exactly. So we have very few minutes left. We have 7 minutes left, and we have actually at the 6 o'clock Geneva mark, we have two options. I've shared them in the chat. I'll come back to them. But first, I want to tell you what is going to happen simply by answering two simple questions on Monday and telling us how it turned out on Friday. Is you'll be seeing and we'll be sharing with you the successes, lessons learned, and challenges as hundreds, perhaps thousands of members of the Immunization Agenda movement are working together to implement. And again, this is all about mobilization. The first time we developed the Impact Accelerator in July 2019, pre-COVID. We saw incredible dynamics of change take place faster than any of us had expected. We also saw people across the many different countries where there were already immunization professionals connected digitally to each other, working together to accelerate, to do better and faster. And we saw a fully digital initiative, which this had been up to July 2019, suddenly materialize in the physical world with literally hundreds of meetings. That happened because people wanted to make a difference. All of the people you see here met because they wanted to. They opted into the accelerator. They chose to participate. And 99% of participants recommended in July 2019 participation in the Impact Accelerator. 98% of participants responded to the evaluation questionnaire. The disgruntled individual had a specific issue, but this is what the accelerator is about, and this is why we are calling on you to implement, which you probably do every day, but to implement together. I'd like to ask Charlotte for her recollection, because this is a photo of her receiving a certificate for her work, amongst other things, in the Impact Accelerator from her country's national EPI manager before she even joined our team. Charlotte, tell us, what is your recollection of the Impact Accelerator in July 2019? What can you tell members who are new to the movement about why this is such a powerful and potentially transformative approach?
Thanks again, Reda. What is important about the Impact Accelerator is that you have developed an action plan, and throughout the exercise, some of you may have thought it was a pedagogic activity, but you understand that it is not just that. It's about action. It's about creating impact. It's about making a difference. That's taking what you have written down and concretizing it. But beyond that, you are not doing it alone. You are doing it with a group of other colleagues from your country, different levels of the health system, who are ready to support you based on the experience they have on what you are doing. So that's great. My recollection, it was the first Impact Accelerator, so it was good, and it was greater because we were able to create that group of scholars from our country and get recognition from the Ministry of Health. So that was also very encouraging. Thank you, Reda.
All right, wonderful. And now one member of the movement mentioned this. I want to explain now what this is about. We have 4 minutes remaining, and it is responsive feedback. Now, some members of the movement received this invitation this morning to join a cohort of responsive feedback members of the movement as you work on implementing your action plan. So it is Professor Vish Wispanath, Dr. Rachel McLeod, and Emeka Emmanuel Okafor, who offered to help members of the movement with implementation of their action plans by providing a quick introduction to a innovative management approach known as responsive feedback. So if you are amongst those who were invited, you received this morning a message from Professor Vish Viswanath from the Harvard T.H. Chan School of Public Health, and the steps are very easy to follow. Be careful though, you will have to read line by line and make sure you follow every instruction if you do not want to miss this opportunity. And members of the movement who opt in, again, it is your decision whether or not you want this support to help you implement your action plan. Well, you will need to opt in, and if you opt in, you will have specific the learning module to complete. And on Friday, you will have a workshop in which Professor Vish and his colleagues will meet you to help you with implementing your action plans and with applying this responsive feedback approach to decision making, to analysis, to making a difference. Now, a few reminders about the mutual support between members of the movement, as well as the availability of the Ideas Engine to help you tackle your challenge and find innovative ideas and practices as you think through what action you are going to set to carry out this week. There's also what to do in case you are absent from the Monday assembly. Now, the focus of the Impact Accelerator is not on the assembly. It is on you getting things done each week. It is more important for you to, on Monday, tell us what action you are going to take, and on Friday, tell us how it turned out, than it is to attend any of the formal aspects of the movement. This is about what you do on the ground, what actions you take, and how you do them. If you have poor connectivity, there are now thousands of subscribers to the IA2030 movement and the Full Learning Cycle podcast. This is a great way, if you have poor connectivity, to really receive most of the testimonials, the sharing of experience, and the specific information you need to make progress in the movement. So before we go to the two options, so I'm going to paste those into the chat again. Option one will be to stay in the Zoom room with us. And oops, okay, that's just the first line. Let me see if I can grab the other lines. I'm having problems with this in our studio. But so option one is to stay in the Zoom room. If you stay in the Zoom room, you'll get to meet the amazing team that is responsible for the IA2030 indicators. And we will be doing what we call a consultative engagement. They'll be sharing information about the IA2030 indicators, and there'll be an opportunity for you to share, both ask your questions and answer specific questions that they have, inputs that they would like to collect to help improve these indicators. Option two is to join your country group to meet fellow members of the movement. Congratulations, Anne Assay, for completing for setting your Monday action and your 4-week goal. So option one is to join the IA2030 indicators team. That is, you do that by staying in this room. Otherwise, I'm going to ask, I hope that Ja is able to help with coordinating the opening of the room. So let me explain how the, let me see if I can get to the Telegram. All right, that's the wrong window. Give me a minute to share the correct window, and then I'll be able to show you how that actually works. So let me see. Yeah, here, this should be it. Yeah. So here, you should by now be connected to your country. And I see actually the Nigerian scholars are already connected. You can see all of the countries here. So what we need to do, what Charlotte and Jean need, is for someone in your country's channel to actually say, we're here, we're ready to chat. We will then open up the space where you can actually speak to each other. We just did this with the Francophone countries. There are more countries for the Anglophones, so please be patient if Charlotte and Jean are not able to open the room right away. So you have a choice. You can stay. Option one is to stay to discuss the IA2030 indicators, and option two is to go meet with your fellow country team members. Of course, if you're the only one from your country, you may want to stay in the room and participate in the IA2030 indicators discussion. Otherwise, it is entirely your decision which one you would like to participate in. I'm going to now bring in Rose Weeks, and she will tell me if, so let me, here we go. And here you can see, all right, here I'm going to share the initial information. We'll ask Rose, first of all, a warm welcome to you, Rose. Thank you so much. I hope, would love to hear your thoughts. I don't know when you were able to join the assembly, if you joined sort of midway, or if you were here from the beginning, or if you've just arrived. How are you?
Hello, I'm doing well, thank you. I don't know how to turn my video on, but I'm really delighted to be with this group. I did have an opportunity to listen for the past 30 minutes to the discussion from many participants who were sharing some of their commitments from Afghanistan, working to counter low demand for vaccination and working to counteract variable access to immunization in urban areas. And from Iraq, Ahmed was sharing how there's been a drop in routine immunization coverage due to the pandemic and fear of health facilities. So I found that fascinating, really, really exciting to hear from the members of this group. And I wanted to get your feedback on something that we've been developing to support you and others like you working around the world to address these immunization system challenges using the IA2030 framework for action as a way to track progress and evaluate progress. And
so,
as
Rose,
you can see,
yeah, Rose, can I interrupt you? Can you first introduce? Could I ask you to introduce yourself? Who you are, where you work, what you do, how you came to be involved with this IA2030 scorecard?
Of course. Yes, my name is Rose Weeks. I work at the Johns Hopkins Bloomberg School of Public Health. I am working as a collaborative effort led by the USAID Momentum Country Global Leadership Initiative. If you go to the previous slide, that would be great. Yeah, oh, I see. That would be nice to put those questions into the chat as well. Thank you. So, as I was saying, I work in partnership with a number of groups that are leading the IA2030 process. So we work closely with the Monitoring and Evaluation Work Group and also the Advocacy and Communications Work Group, because we want the scorecard, which is an interactive dashboard that is designed to show progress toward each of the IA2030 indicators being tracked in the framework for action. And so we're hoping that it works as a performance management tool to strengthen accountability and measure performance, and also as an advocacy tool to support further raising of funds and also allocating of technical resources to meet the goals set out of in the IA2030 agenda. Yeah, and then Retta, is there anything else that you would say to sort of introduce the tool? I'd love to show it if we can. I can also put the link in the chat.
If you could put a link in the chat, I should be able to share it on screen. And then you have 4 specific questions that you have shared, and I'm showing them now on screen. And if you want to go ahead, yeah, okay, great. And so let me just, and we'd like to ask members of the movement in the room. There's still 257 people remaining in the room. So thank you for staying on, and thank you for showing your interest in this, in the IA2030 indicators. First question is, do you think the scorecard may help you focus your work and commitments to supporting IA2030? Question 2 is, do you think the scorecard can help leverage support to address performance issues highlighted, and that support could be technical, advocacy, financial, or other? So as you think about these questions, if you don't see immediately how to answer them, but you have questions of your own about the scorecards, please raise your hand. Third question is, will the scorecards country pages? So we'll have to show those. Rose, I'm going to ask you to guide me through the dashboard. And what are the most relevant pages for you in the work that you do? So those are the questions that the IA2030 scorecard team has come up with. This is the overview dashboard. So what can I find here, Rose?
Yeah, exactly. So this is a sort of the at a glance version of the scorecard, is all of the different goals being tracked through the framework for action of IA2030 are here, and you can see at a glance how everyone is doing, how the world is doing based on compared to baseline data. This is the first view of the scorecard. So there is no basically this is just the baseline data, but we can see kind of at a glance how how the world is doing in terms of number of outbreaks. This is the number of zero-dose children. Just if you could pause for a minute, just if on 2.1, this shows that instead of reducing the number of children who've never received any vaccines, unfortunately, we are increasing the number. And so what we'll see as the 2021 indicators are reflected here through the mid-year reporting from WUNIC, which includes the coverage estimates, as well as other indicators coming through the joint reporting form through WHO, we will see a lot of backsliding for 2021, which won't surprise those in the room here. But we're hoping that as we start showing, where the indicators are falling behind, then there could be more resources generated, more attention from the news, the news media, to try to address some of the shortfalls in immunization programs. So you can continue to scroll down so you can see all the different things that the Framework for Action is tracking, and that many of you are also working on. There isn't as much data with these indicators at the bottom here, the strategic priority indicators, because it will be reported starting in 2021, which was the data is being sent into WHO right now. So it isn't available yet, but it will be available in the middle of the year. And I wanted to flag, so yes, you can sort the data by region. This is the African region data at a glance.
All right,
and so if you
Rose, we're going to pause. We'll come back to the demonstration. Hafsat Yaou has opened their microphone. So Hafsat, we'd love to hear from you. Please tell us, when did you join the movement for IA2030? Where do you work? And what questions do you have, or questions or comments do you have about these indicators that are supposed to measure progress towards the goals of Immunization Agenda 2030? Hafsat, it looks like you have a problem with your microphone. I see Henry Guam has also has a hands raised. So Henry, let's go. No, Hafsat, I would suggest for those of you who have problems with your microphones or with connectivity, like Hafsat, please go ahead and type your questions or comments in the chat. And then I'm trying to unmute Henry Guam. Henry, are you able to unmute? You should now just be able to activate. And this is normal. It's amazing we're able to connect in these ways. It just takes time and sometimes a little bit of patience, Henry. And if there are other questions or comments, we'd love to hear from you. Rose is really keen to listen as well as to present to you the IA indicators of work that's been done so far. All right, it looks like Henry has lowered his hand. We do have Samuel DBIA, but Samuel's hand has been up for a long time. So, all right, Rose, let's. I've pasted the specific questions in the chat, and Rose, tell us more. We're looking now at the regional indicators.
Yeah. So you can view the performance of each of the regions at a glance here across all the indicators. And then when you click on Explore Data, that's when you get the really interesting visualizations. So here you can see the number of deaths averted by vaccination in the baseline year. So if you scroll down, it should be sorted by antigen. And so we're trying to get overall to 50 million deaths averted by 2030. So if you go up for a minute, actually here you can see this, there were an estimated 1.6 million deaths averted through vaccination in 2019. And you can see how many, each of vaccinating against each of the diseases contributed to that overall number. So that's really exciting. And you can see how each region will make a strong contribution to averting 50 million deaths by 2030 from this view.
So, Rose, I have a question for you. Most of the members of the Movement for Immunization Agenda 2030 work at the local levels, so in health facilities and districts. How do you envision that these global and regional level indicators, I know there are country ones, I don't see them, obviously, perhaps you can share the link. How do you see these being useful for people who are in their own local context, developing action plans, based on the specific strategic priority, focused on specific key areas of focus of IA 2030? How could these indicators be helpful to them?
Well, when we've talked to other people from working in countries to increase vaccine coverage and address other immunization challenges, they've seen that it's helpful to kind of put their country performance in context with neighboring countries. So I wanted to share what will be launched in a few months. It's not yet launched, to get your feedback on. This is kind of a report card for an individual country. And so I think Retta's pulling this up now. This doesn't show real data, but it's showing like a preview of how each country will be able to see its own data as it's being tracked toward IA2030 across all of these different indicators at a glance. And we would love to get your feedback on this in particular. We've heard from, I don't want to sort of bias the discussion about how other people have said they'll use it, but just keep in mind, none of this data is real. This is just what the design will look like. But wanted to hear your thoughts about where your country, would you compare, your country to neighboring countries or to the region, and how could that help you looking at your performance as a country, of course, not as a, not subnational, but, putting the context of the performance in this, you can see at a glance how each country is contributing to the indicators that are listed at left here.
And I'm going to repeat what Rose said. This is not real data. So for the Pakistanis in the room, please do not come back saying that you disagree with it or that you object to this, to what is being presented. And again, Nicole, Rose is very much interested in hearing from you. If how you see that this could potentially be useful, the country-specific information and data. Are there questions and comments? All right, so Syed says the global and regional figures are good for universal health coverage, but it would not work for us at national or subnational level. So Syed, if you say that, I'm going to ask you why, right? Yes. So please go ahead. You work in Afghanistan, EPI, and I know you have a good connection. Yes. So I'd love to hear more. Why would this the global and regional figures not work for you at national and subnational level?
I'm audible?
Yes, loud and clear.
Okay, thank you, Rita. Thanks for this links and this information. This the region, the global and worldwide figures in this regional level. Even though Afghanistan is one of the countries that is coming under the IMRU region, but this is the total figures that is cumulatively data is presented in this links. It wouldn't help us because we are working at the national or sub-national level. So it went because we need, particularly, we have to decide based on the evidence that which we have in the country, how we hit the data which is given in this links will help us, because we have to decide based on the evidence which we collected from the district level or provincial level, and based on those data which we have in our hand, we have to decide and we have to plan accordingly and implement our action. And intervention is will be very efficient and effective if we think about our local issues and problems. So these things will not help us in our work. Thank you.
Right. So Syed, maybe
thank you. I just wanted to mention, we do recognize that is a one area that this is not covering, the subnational data. We've also heard that before from other stakeholders at the country level. I just wanted to show one aspect that's on this page that you can see that pertains to subnational immunization coverage. If you scroll down, the framework does include coverage in the lowest performing districts. So stop here, it's 3.2 coverage in the 20% of districts with lowest coverage is listed here, but it's not detailed from district. It's not listing like the specific district that are being tracked here. But I thought that might be relevant for your work and just looking at how to ensure at the district and provincial level how to accordingly plan your actions and your intervention.
Thank you, Rose. And my follow-up question for you, Rose, is is there a way for there are over 8,000 members in the movement for IA 2030 who've made a commitment to achieving impact is there a way for them to report, to feed into these indicators, to contribute to them, to show that progress at the local level is in fact being made or is in fact being blocked or impeded by various barriers? Is there currently a mechanism to do that?
Yeah, I think that's a really exciting idea. One comment that we've already been really exploring a lot is how to include data that's a little bit more like storytelling and qualitative data that includes real stories from real people who are working to make a difference into this dashboard, which is all numbers at the moment, but I think could be strengthened with these kind of stories and accounts and specific look at how is this district doing, and what is the progress being made, how are these indicators helping to illuminate where progress can be made, and focus the work and the efforts.
All right, we now have several, or actually one new hand raised. Lemi Kebede, your hand is raised. I've been asking you to unmute. I don't know if you're having difficulties. If there are other questions or ideas about how members of movements... Yes, Lemi Kebede, tell us, when did you join the movement? Where do you work? Oh, all right, Lemi has unmuted. Let me see if we can bring him back, or if that was just a mistake. But so yeah, back to the room. You see the 4 questions that Rose is particularly interested in listening to your answers about, and then so we will mark a pause here while you think about it. And thank you, Rose, for resharing the scorecard link. Of course, if you're unable to speak for whatever reason, you can type your answers to these questions in the chat. I will then try to read them or summarize them. This is, of course, a very important aspect of Immunization Agenda 2030 for those of you who have spent time studying the framework. You already know this. So, but we are, again, in the context of a consultative engagement. All right, let me see. Okay, so Rose is asking a very specific question. Can you load this on your phone? How does it look? If you could give her feedback, that would be great. And then Kalu Joy Mba wants to know what the scorecard is about. So rather than, so let me just ask Kalu Joy Mba if Kalu is able to speak. And then we'll go to Rose to ask her to answer that question. All right, Kalu Joy Mba.
Hi, Rana.
All right, hi. Can you remind us, when did you join the movement? Where are you connecting from? And what do you mean? What is it about? Yes, can you hear me?
I can hear you. I can hear you.
All right.
Can you hear me?
Yes, we can hear you, but it is a bit garbled. So can I ask you, Sukala, you typed a question in the chat. What's the scorecard all about? So let's go to Rose and give Rose a chance to answer that. Rose?
Yeah, basically, as I said in the chat, and Kalu, I hope you can hear me. I did hear you, but we were hoping to hear a little bit more about, your interest and your question. But thank you for the question. We are hoping to help people understand how the immunization agenda movement is being tracked at the global level, the regional level, and the country level, and how progress is going. Basically, just reporting on the global progress toward meeting each part of the agenda's goals. So some of you described, wanting to see, the dip in coverage that many countries have experienced during the pandemic addressed. So you're working to increase vaccine coverage because coverage has gone down. We hope that the framework, the scorecard will make this very visible, this problem of drops in immunization coverage during the pandemic. When you come here and you see the 2021 data, which by the way is not yet visible because we're still reporting on the baseline data for the scorecard, the 2021 data will show the impact of the pandemic in the first full year of the pandemic. And we should see, fortunately, many of the indicators kind of in the red. And so there'll be an exclamation mark where you see backsliding for each of the indicators that's included in the IA2030 framework for action. So everything from the number of new vaccines introduced to vaccine coverage, to hopefully not outbreaks, but we are already seeing more outbreaks of measles as a result of that dip in coverage. And so we hope it'll be really easy for people to see what the problems are at a glance through this very visual tool. And then people can use that, maybe take screenshots, you can download it for presentations if you're making a presentation for maybe, a health minister, that people can use these visualizations to make a very clear argument. We need to focus here because this is where we see a lot of backsliding, and that will be a tool for you.
Rose, thank you. Gentil Faraja is unmuted. Gentil, we heard from you during the assembly. You're from the Democratic Republic of the Congo, and you are, I believe, a researcher. Remind us when you joined the movement, and what are your questions or comments in response to Rose Week's presentation of the IA2030 scorecard?
Yeah, thank you. Am I heard, please?
Yes, loud and clear.
Yeah, great. So I just remind a little bit about my integration in this movement. It means I was there at the first launch. I was there, but since then I was very busy. I didn't get the time, but I said that I completed my action plan, I think today in the morning, and I'm ready to go for the rest of the program. So I hope I'll get some free time to be there and make sure I'm on the same boat with the IA2030 movement. So as I said, I'm working, for the Center for the Promotion of Vaccination for Community commitments to improve immunization coverage across our country. And so I've been trained in 2021 last year by the University of Queensland in anti-vaccination and vaccine hesitancy. And so today, as I'm part of this movement, I want to get the point of view, indications to what is going to be the long-term feedback, or the long-term support that we'll have from the IA2030 movement. As we're working on the local grounds, local levels, we do have some challenges, in Congo. Everybody knows about Congo DRC. And so for all these movements who are working, they are remote countries on the local grounds, and perhaps they have some challenges, relating to their capacities of interventions. So what is the long-term strategy of the IA2030 movement to support all these member organizations on the local ground so that they may be, they may apply all these strategies and make sure, we are at the best of our levels, on the ground. So I want to get the feedback to know the long-term strategies, and as long as we remain members of the movements, apart from the training we are receiving, capacity buildings, but practically what is going to be as well the support, the technical support, or even research support that we'll receive from the IA2030 movements, the long-term strategies.
Okay.
So,
Gentil Faraja, thank you.
But please fix me.
I understand that. I understand and share the concern of how to resource if there are people who are on the move and want to implement projects. I believe, unfortunately, that is not directly related, unless Rose Weeks tells me different, to the IA2030 indicators, which are reporting on progress. Rose, there is a concern or a question about resources. Is there anything in the IA2030 scorecard that is tracking the use of resources, the availability of resources for, towards achieving the goals of IA2030?
Yeah, no, actually, that is an explicit goal of the scorecard, and that is, and I think it could be much better defined personally. But we are hoping that the framework, or I think the intention of the framework for action was to help direct resources where you can see, again, the scorecard will show at a glance where we are not making progress, where we have backsliding, when there are more outbreaks instead of fewer outbreaks, when there are, we're not meeting elimination targets for measles or rubella. Seeing that really clearly in a visual way through the scorecard should help with potentially having, I don't want to, like, donors commit funds, to address an area that has a lot of backsliding, or potentially, a group of working group at the country level to really focus attention and efforts. And they might be technical resources as well as financial resources. But that's the goal, is to improve accountability and mobilize resources through the framework for action. So I thank you for bringing up that point.
Thank you, Rose. So we have now Diana Aquila. Diana, I'm asking you to unmute. Otherwise, we have Nelson Mandela, who is ready to go. Diana, would you like to unmute? Would love to hear from you if you have questions about the IA2030 indicators. We also have Bernard Bediako and Raimi Morufu, who are, so let's start with Nelson Mandela. Over to you. Don't forget to introduce yourself. Tell us who you are, where you work, and what are your questions or comments or feedback for Rose Weeks, who is working on the IA2030 indicators. And please focus only on that rather than any other concerns or issues that you may have.
Yeah, you're speaking to Nelson Mandela Albert, based in South Sudan.
Yes,
I work as a healthy worker. Based in Juba, and of course, I've got all the concerns, the experience that some of my colleagues in other countries are able to present. However, I only have a comment based on all the discussion that we had. To me, thinking that if at least we will move to other countries, like myself, maybe I'll move to Uganda and also do my practical observation and see how Ugandans do their strategies or practical work on ground. Then also Ugandans or else have us to come to South Sudan and also do observation how South Sudanese do their activities on ground.
Thank you, Nelson.
Hello.
That is a unique opportunity to be able to gain that perspective across countries. This is part of what we do in each of these assemblies on Monday. Let's go to Bernard Bediako. Bernard Bediako, are you there? Are you able to speak to us? And then let's go to Raimi Morufu. Raimi?
Yes, good evening, Reda. Good evening. Can you hear me?
Yes, loud and clear. Now, you are calling in from Nigeria. Remind us what you do when you join the movement, and then what is your comment or question for Rose Weeks about the IA2030 indicators?
Okay, I want to your efforts giving me this Impact Accelerator in the movement. So I must say, Reda and Ngo, thank you so much for still keeping me.
Okay. All right. I think, unfortunately, with that, it's just one of those days, and this will happen. Raimi, I think we just lost you. There are Diana. We haven't been able to hear from. I saw Bernard.
Eli. Be that it was, I think it was at the moment so many.
Oh, I think we lost Raimi again. Let's try to go to Bernard Bediako. Raimi and Diana, please type your messages or your comments or questions into the chat. Bernard, over to you. Let's try.
Hello?
Yes, Bernard, do introduce yourself. Tell us remind us when you joined the movement, what country you're from, what your work is, and then your questions and comments for Rose.
Thank you very much, Reda and your team. So I am from Bernard Bediako from Ghana. I am a district director of health services in one of the districts in Ghana. And I am a pharmacist by profession. scorecard is not something new in Ghana because it is used to assess the regions and the districts for public health and clinical indicators, our performances. So for me, scorecard is very, very important, especially when it comes to advocacy and resource mobilization. And so looking at the indicators that have been given, I feel they are very good indicators, especially with my background as a pharmacist. I'm concerned about adverse events following immunization. And then also with the SBCC, that's social and behavioral change communication. These are all very, very important, especially if you want to encourage people or caregivers, mothers, to bring their children for immunization. Then there should be a strong social mobilization. And I believe that in this is one of the indicators. It will help the country to know whether they are doing well with social mobilization, so that if the social mobilization strategy is weak, they can strengthen it, so that it can help in reducing hesitancy when it comes to vaccination. So for me, the indicators as given are very good. With a timeliness of 90%, I am also looking at completeness of the data entry. So it shouldn't only be the timeliness of data entry, but also the completeness of the data entry. And there was a question also about resources. I think that resource is also very, very important. So it should be part of the indicators. I haven't seen a specific one considering resources. So if you can please help me with that. Thank you.
Rose, over to you. And then there are a number of great comments in the chat from François Gass, from Annika Scott, and others.
Yeah, no, thank you so much, Bernard. I think your name is Bernard. I'm really, really interested to hear how this will be used in Ghana. And I'm happy to hear that you're familiar already with scorecards. It sounds like Ghana does make a lot of use of this performance management tool that is the scorecard. And also about your interest in rural communication and strong mobilization to support vaccine demand. And that is so important. I wanted to mention that many of the strategic priorities refer to there are new things that have never been tracked before, IA2030. And so they are for the first time ever, they asked the countries about how they're doing with demand generation in 2021 in the joint reporting forms. And so that data will be reported for the first time ever this year when we get the 2021 data from the joint reporting forms. So we will be able to see how each country is doing at addressing raising demand for immunization through mobilization, as you've described, which is a very big priority. We don't have that data available right now, so it's not on the scorecard, but it definitely will be a key part of the scorecard, and hopefully, be able to learn, looking at across from country to country at how each country is doing in some of those indicators. And then regarding resource mobilization, there are some indicators related to financial expenditures on immunization programs. And also I'll direct you to, there's going to be two. One is available now. It's indicator 6.3. So I'll just put that in the link in the chat. But this is about how much of the resources spent on vaccines comes from a domestic government source or from other sources. So that might be of interest to you.
Thank you, Rose. I just want to highlight and put into the audio transcript two comments. One is from François Gass, who asks, will you develop scorecards for districts and health facilities to facilitate progress towards the national scorecard results? He says it could be useful to see where to prioritize the focus. And then Annika Scott from Guyana says that the scorecard can help in advocacy at the level of political buy-in. It actually can also be utilized as a tool for budgeting and work plan determination. Finally, she says it can also help to justify the resources that we will need to meet targets. So, Rose, any thoughts on François Gass's question? If it could be useful in your view to see to develop scorecards at the sub-national level for districts and health facilities, and then to members of a movement, the corollary question is, would you be willing and would you see value in contributing to that, reporting on your progress in your district, in your health facility, to help build an accurate picture of what is happening with progress towards the IA 2030 goals. So first, Rose, and then we'll go back to the participants.
No, I think that's such a great suggestion. It would be really beautiful to see that happen, so that you could track the contributions to making these really, really big, challenging things happen at the global level, down to the region, the country, and even the subnational, provincial level or district level even. So that would be phenomenal if we had that, ability to track at that level. So thank you for that idea.
And Rose, a quick follow-up question. This is also from Annika Scott, who wants to ask, in case she missed it, she says, were there consultations done with some countries in order to develop the existing, what you showed us, the IA 2030 scorecard?
So yeah, absolutely. I will say this is part of our ongoing consultation, because we are very interested to hear thoughts from the members about how it's potentially going to work or be helpful, and what are the missing components of the scorecard. So I am furiously taking notes, and we have been speaking. We've spoken with a number of especially immunization managers at the regional level, and we're really we've probably done maybe a dozen of these interviews, but this is a really important opportunity for us to hear from you. As you've seen, the country pages are not yet live. While we do expect them to be published in a very similar format, we could make adjustments based on the comments that we receive from in this form and other similar forms.
All right, thank you. Tracy Nkirote from Kenya says she's a health records officer by profession, and she says the scorecard will give us reliable data that can be analyzed to give the correct information about immunization coverage. She has a longer comment, but Rose Weeks, how confident are you that that is actually true, that the data in the scorecard truly reflects the reality on the ground in the countries that the scorecard is reporting on?
Yes, no, thank you for asking that question. So the scorecard has details at the bottom of every visualization. So each indicator has a designated page with a visual of that indicator and the trends across the decade. You'll see where the data comes from. None of the data is unique to the scorecard. It all comes basically from WHO and UNICEF. I think there's a few exceptions to that, but we're sort of compiling data and aggregating data from a number of sources in one place. And that's why it helps really paint a picture for the full breadth of the immunization system performance more than other resources have in the past. We think the framework is extremely comprehensive, the framework for action. And it's really unprecedented how many different data sources are pulled in. But data is not uniquely, it's certainly not being collected by the scorecard website. It's being done in partnership with WHO and just using the sort of available sources that are listed there. So hope you can take a look at those, if you have any questions about the specific data.
All right. I want to appreciate the rest of Tracy Nkirote's comment, which is her action plan, her IA 2030 action plan is to rally for more qualified health workers, especially the UHC interns in her country who worked for a year to be employed by the Ministry of Health to achieve the goal. That's that kind of very local context, very specific context, very specific goals and challenges. How does that, Rose Weeks, fit into the IA 2030 scorecard? Issues and challenges that when you're working in a district, a facility, or even at the regional level, are going to make the difference between how effective the performance of your immunization program will be.
Mm-hmm. Yeah, so I think this might be about health worker recruitment and retention. And those kind of indicators are tracked. There is an indicator, and again, this is one that we don't have the data yet because it was first collected. If you go back to the other website, you can see if it's actually 1.2, indicator 1.2, that's a strategic priority indicator. But it's first reported this year, so we haven't gotten the data, but we will be able to compare, for example, Kenya to neighboring countries or any country in the region in terms of how the health, what the proportion or the availability of the health workforce is in that country compared to the region and to other countries in the area. So I hope that might be useful with what you're working on. It sounds like a really important strategy and plan. Very exciting.
All right, thank you, Rose Reeks. We have gone over time. This was a short 30-minute session. We often find that we can do at least as much in 30 minutes as those 60-minute webinars tend to do. I'd like to invite you, if you'd like to connect with Rose Weeks outside of this assembly, to share you can share your email address. If Rose, you'd like to just copy and paste from the chat, perhaps follow up with individuals who have a specific question or interest. And Rose has kindly shared her own email address. There's still 172 people in the room. I know most people did go to meet with their fellow country colleagues, but glad to see that there is a really strong interest, it seems, in how we measure progress, how we track progress, and what counts in the IA2030 indicators. Rose Weeks, any final thoughts or comments? What are your next steps in order to to sort of officialize and then roll out this IA2030 scorecard? How late in the process are you asking for feedback and inputs from people who deliver vaccines?
Yeah, we're really in the middle of the process, so we're very, very keen to hear from the members about their vision for how this tool can support their work and what additional components might be needed. I will say I recognize it's only in English now. That's one of the really short-term goals for the balance of the year, is making sure it's at least in French to meet the need of accessibility to the Francophone countries, of which many of your members come from. So thanks very much. I just wanted to say I hope we can share all the chats. I'd love to read through all the chats because there's so many great comments. So thanks for the opportunity.
All right, wonderful. Thank you so much, Rose Weeks. And I believe did you have colleagues in the room? We haven't heard from them, but we'd like to thank them if they are here.
Thank you.
All right. Rose, do you have colleagues in the room? Anyone we should acknowledge?
I don't have any in the room today,
okay.
But maybe another time.
All right. Thank you very much. This brings to an end the sort of extended session dedicated to consultative engagement in the movement for Immunization Agenda 2030. Thank you for your time. Still so many people in the room. I just want to repost the instructions. If you'd like to join your country colleagues, I'll just post option 2, and I know there's at least one person who is still, so here are the instructions if you want to go to the to join your fellow members from your country and talk about continue the discussion, talk about the launch of the accelerator, share your action plans, just get to know each other better. That is key, that is central. Not only the connections and the information we share with you, but also the connections that you have with each other. Take care and see you. Remember today to set that specific action, and Friday you'll be telling us how it turned out. Thank you and take care.
Thank you.